it's the district's, I'm sorry, it's ultimately the center's responsibility to get their teachers and stuff enrolled and involved in all this. But I feel like if I get an email saying that all this stuff is available, I'll probably ignore it. But if I sit down with my licensing consultant doing a visit or doing the ratings scales or something, QRS, something like that would be a wonderful tool that we can reach out if we have questions other than trying to do all the research ourselves.
That's a great suggestion, Dan. Great suggestion. And just real quick, and I was thinking, as I mentioned to you, that I visited Central Piedmont to talk. It would be great if I, and our community colleges are already doing such a phenomenal job. But in addition to our preschool certificate and our infant toddler certificate, maybe we can create certificate programs that support different pathways, and that could sort of spark teachers to say, I have some teachers that are more interested in curriculum. Maybe there can be a certificate program that has 6 classes that are, once you have your EDU 119 and 1 or 2 fundamental classes, it could support curriculum development. There could be one that supports behavior supports and challenging behaviors. And there could be 6 classes in addition to EDU 119 and one other. So there, I believe there is an opportunity that if we can maybe tie in with our community colleges, and I don't want to put everything on the community colleges, but a lot of educators feel a little intimidated by just a 4-year college route. But if the community colleges had some opportunities to create some certificate programs that speak to, with this certificate, it provides support and a foundation for careers in creativity, curriculum, special, those sorts of things. So just kind of thinking, just like they have a certificate for administration as well. So I just kind of thinking along the lines of that.
Great. Appreciate both of those ideas. We don't have Dr. Olvera or Candace on the call, but we can certainly share those ideas with them as their broader task force members. Any final thoughts on this before we move on to the next segment, which is around health insurance?
Yeah, I would just add, I think it'd be remiss if I didn't add that we some in incentivizing those who serve our most vulnerable populations. I mean, we're in a time right now where it seems like vulnerable populations are losing more and more supports, and we've got to do something to counter that. Whether that come in concert with the recommendations on other types of certifications, but incentivizing those certifications, incentivizing child care workers that work at facilities that have a certain percentage of vouchers and things like that. So we really have to consider our most vulnerable, because as they lose supports, they are the ones that suffer the most. So I just think having that kind of a mindset and how we can incentivize high quality for the most vulnerable.
Really appreciate that, Brian. Thanks for that perspective. All right. Thank you, Anna and Brian. Really appreciate you all joining us. You're welcome to stay. As you mentioned, health insurance is a topic of great interest, and that's what we're going to be pivoting to next. So thanks again. And folks on the work group, if you have other ideas that come to you later, please don't hesitate to share those reflections with me afterwards, and we can continue brainstorming how we lift up this recommendation. So with that, I'm going to move us on to health benefits for childcare professionals. And again, going to turn it back to Elizabeth, who's been really instrumental in doing a lot of this background research. Thank you, Elizabeth.
Awesome. Thank you. So yeah, we'll be diving into health benefits specifically, and to just provide some quick background. So the latest data we have on health benefits for ECE professionals comes from 2023, at which time only 49% of licensed childcare centers offered health insurance benefits to their employees. 17% had fully paid and 32% had partially paid, and rates of uninsurance were between 12 and 15%. So we're not aware of kind of data that would allow us to understand more broadly the breakdown of health coverage or health coverage eligibility across ECE professionals. So thinking those who are eligible for Medicaid, marketplace subsidies, employer coverage, the uninsured population, but recognize that moving forward, looking into some of these different interventions that might be helpful to understand more clearly. So just to frame the issue again, so there's kind of two objectives we can think about with this recommendation. One is just purely ensuring that all ECE professionals can access health benefits, making sure that we're supporting this critical part of the workforce. Secondly, leveraging health benefits as an actual recruiting and retention tool. So being able to go out and say that this is something that if you enter the profession, you can access. So with that kind of first goal, would really need to be focused on, maximizing coverage wherever we can. So that would include Medicaid and marketplace enrollment. And I think another really important point here for the work group to think about is the impact of coming changes from HR 1 and thinking about how that's going to affect our early childhood education professionals specifically. So that may be something we want to consider for one of the recommendations. And then if we're thinking about this kind of second goal around a recruiting and retention tool, that could lead us down kind of a different approach in terms of trying to have something that would be like broadly applicable to all professionals, or framing something around comprehensive coverage, even if that's through a different set of coverage pathways. So one of the things we'll want to touch on when we get to discussion later is, from the work group's perspective, what all do you want to be kind of really the goal that we're focusing on here? So through our research, we've identified kind of 4 different approaches that we looked into further for providing health benefits. Again, would love to hear any other ideas that have come up for people. So one is providing premium assistance through the marketplace or other plans. We'll talk about a few states that have done that. The idea that we've discussed before around the state health plan, adding ECE professionals to that. Providing health insurance through an association health plan. We'll hear from Steve from the NC Chamber in a little bit around their multiple employer welfare agreement, which is, my understanding is similar to an association health plan. And then kind of at a bare minimum, at least increasing kind of awareness or navigation support to make sure that people are at least accessing what they are already eligible for. So in terms of marketplace premiums, we talked a lot about Washington, D.C. in our interim report. So they've created a special fund to provide free or reduced premiums for employees of licensed childcare programs who enroll in the marketplace. Washington State previously provided a premium program. They had $30 million over a couple years that provided $0 premiums through the marketplace. But they did find that when that program ended, the vast majority of participants would qualify for other federal or state subsidies. They also provide specifically for family home childcare providers through a collective bargaining agreement, insurance at a $30 premium through private insurers. And then Connecticut is developing a program to do this right now. They have $10 million to fund a health subsidy program, which they're currently developing. So this would obviously require additional funding for North Carolina to consider, but there is precedent from other states to have done this. In terms of the state health plan, I know there's been interest in exploring this. Wanted to provide kind of a little more context on that. I think our ingoing perspective is that this would be quite challenging for a number of different reasons. One, we haven't found any other states that have pursued this option. I think it is likely to be quite expensive for the state. So a couple notes on the state health plan. Right now is facing large deficits. So kind of a difficult time to be thinking about this potentially. And also the state's contribution per employee is $8,500 annually. So if we think about that in terms of trying to provide for all ECE professionals, that would be quite expensive for the state. And kind of contrasting this to trying to make sure through other routes that people have health insurance that might be a kind of less expensive option. Association health plans, I won't touch on in detail since we'll have Steve talking about Carolina HealthWorks in a few minutes. But just to say that there is kind of precedent both in North Carolina for providing this type of coverage. So the Retail Merchants Association has offered access to an association health plan for small retail businesses. In Minnesota, the Child Care Association offers a health plan to their members. And Michigan, the state is partnering with the Small Business Association there to pilot a program which offers health and other benefits in a partnership that they announced this year. So again, kind of a promising option to consider that other states have done as well. And then, as I mentioned, kind of at the bare minimum, trying to make sure that there is sufficient kind of awareness of what supports are already out there for accessing health insurance and providing navigation support. So, for example, Washington, D.C. Funds several staff positions, including bilingual staff, who can help childcare employees enroll in health insurance. Washington State also included this as part of their premium assistance program that I mentioned and continued it afterwards as well. And New Jersey through childcare, where this is kind of like the lowest level option, provides a very clear summary of healthcare coverage options and directs people to their marketplace navigators. And as I mentioned earlier, I think this type of support is going to be increasingly important as it gets kind of just more and more difficult for people to access what they are eligible for. So I'll pause there and pass it back to Madhu to introduce Steve.
Well, Steve, really appreciate you being here. Steve is from the North Carolina Chamber. I'll let him share his title, and really excited for him to share more about Carolina HealthWorks, which is a very new initiative. So turning it over to you, Steve.
Yeah, absolutely. Thank you. And if it's okay, I'll share some slides here through the tool.
Sure.
I joined the North Carolina Chamber just recently, just a few months ago. But I have been brought in as the Senior Vice President of Business Operations, sort of a dual role. One is to operationalize sort of the back end of Carolina HealthWorks, which we're going to talk about. But then the other part of my role is just sort of looking at internal operational optimization in areas that that we can do here within the chamber to make it that much more efficient to kind of meet the mission. What am I doing here? I do not know WebEx. So window, here we go.
Did you find the share?
Yep, I got it. You should see it now.
Yep, we see it now.
Perfect. So let me just take a few minutes and take you through Carolina HealthWorks. And I think the broader discussion here that you all want to have is there an opportunity that this plays into sort of solving the gap for healthcare coverage for some of our childcare providers? So let's just kind of go through this. So this presentation, I'm going to talk about what HealthWorks is, why so many people are excited about it, give you a quick update on the status, a little bit of overview of like how this is designed, how it works, and then we'll talk about Federation members, which are local chambers of commerce, and then how they're engaging in this. And I probably will not talk about program marketing other than just to talk about awareness that's happening. So Elizabeth, you stole my one sort of fun slide here at the beginning because you actually knew what a MEWA was. So North Carolina, or the Carolina HealthWorks is a self-funded non-plan MEWA. That should be pretty clear of exactly what all that means. Just kidding. But let me sort of spell this out. So MEWA is a multiple employer welfare arrangement. So essentially what this is where a group of smaller employers come together to get purchasing power and act like a larger employer as it relates to getting healthcare insurance and coverage for their employees. The self-funded component of this means that the plan itself is funded by their members. In other words, the employers that are getting health insurance through the plan. And it's sort of back-ended and funded through the North Carolina Chamber. We established a healthcare trust that has a funding level that basically helps to act as a buffer between sort of payments coming in, premiums coming in to the trust, and then claims that are paid out from the trust. The nice thing about the trust aspect of it is it's sort of the more employees or the larger number of employees you have contributing to this health plan, the more your risk is mitigated as it relates to large claims and other aspects that would normally make it cost prohibitive for a small organization to have a self-funded plan. And then it's the non-plan component of the MEWA means that the MEWA itself is not the health plan, meaning that not all of the organizations that buy Carolina HealthWorks insurance, they're not buying one plan. They each have their own plan, which is risk adjusted for the organization that they work for. Primarily, the benefit there is if you're risk adjusted for your organization, if you're not in a high risk industry or a high risk organization, typically you're going to have rates lower than the community rated pool that's available today. So let's just talk about this. I touched on a few of these. The benefits for going with sort of this approach is it's lower cost, it's predictable. The predictability comes from the standpoint that premiums are set at the beginning of the year, so you know the payment process or the payment amount as you go throughout the year. You do have control over the health insurance that you are able to select. There's about 29 plans, including vision, dental, healthcare. There's high deductible plans. There's other options within the makeup of those plans within the Carolina HealthWorks portfolio to give those companies and organizations flexibility to make those choices that meet their business. I've talked about risk pooling a little bit. Again, the more people you have in a pool, the more you are able to absorb those single high sort of cost of care events. So if you have one individual that has an episode that is a very high cost, the broader group is able to work together to support that risk. I've already talked about experience rating versus community. Again, it's just you are on your own health plan. You are risk adjusted for the organization that you have, which is typically going to be lower than what we're seeing currently today in the community rating. The administration associated with these self-funded plans can be somewhat onerous. By having the MEWA operates all of the administrative aspects of the plan. So each individual small business does not have to do that. They don't have to remain compliant, or they have to remain compliant, but they don't have to file the compliance paperwork. That's all centralized. There's a single centralized tax filing, et cetera. One of the biggest, or actually probably the last two are the biggest available within this offering is the ability to get stop loss coverage in a small organization is typically it's not heard of, it's not available. What stop loss allows is it allows for, if you have high claims, you basically have insurance on top of your insurance to make sure that the organizations that are within the MEWA are covered for those high payments. Basically, there's a shared level of risk up to a certain point, and then insurance kicks in. Think of it almost as a hedge against sort of runaway payments due to high cost of care. And then the final one is a renewability guarantee, which basically says once you're in the plan, you have the option to renew the plan as long as you continue to qualify for the plan. I know that's a little bit nebulous, but essentially qualifications are you have to be in an organization of 2 to 50 qualifying employees, headquartered in North Carolina and a member of a participating local chamber or the North Carolina Chamber to be able to renew. The renewability guarantee essentially means as long as your company fits these eligibility requirements, you cannot be kicked out because of conditions that emerge within the execution of the plan or over the course of a year. So members cannot be kicked out for pre-existing conditions. They are guaranteed the ability to renew their insurance underneath Carolina HealthWorks. So a couple of points: qualifying employees, those are W-2 employees, and the one nuance of that is they cannot be spouses. They actually have to have another employee associated with that, but it can be two individuals in an organization. Again, they just cannot be spouses because that is a non-qualified employee. So quick update. So this was actually approved. The plan was approved by the Department of Insurance on October 31st. This has been something that's been in the works for quite some time. The original legislation that passed the General Assembly passed last November. There was some additional legislation, a small amount of clarification that had to be passed in the short session a couple of weeks ago. That was done. We were able to meet the requirements of the Department of Insurance. The approval came late on the 31st, which is an interesting date if you follow open enrollment, because open enrollment started on November the 1st. So we didn't have a whole lot of time to kind of go from working through compliance and sort of regulator questions to getting to a place where we were ready to start engaging in quotes, doing quotes and engaging with some of the small businesses. The trust that backs into all of this, that funds a lot of this, is actually already established and funded. All of the insurance that is being delivered through Carolina Health Works is actually delivered through Blue Cross. So Blue Cross's agent network has been trained and is starting to work with those small businesses. But one of the things that we talked about when we talked about sort of qualifications, we mentioned that they had to be a member, and I think the official legislation wording is a dues paying member. So there has to be some connection to a chamber organization. The North Carolina Chamber is sort of hosting and founding this MEWA, but it is also available to the members of our local chambers, which are called the Federation of Local Chambers. There's about 90 Federation members today across the state, and I do have a map I'll share with you in just a second. But those 90 chambers represent about 61 counties. And it's because there's some of the larger counties have multiple. If we look at Wake County, for example, you've got Raleigh, North Raleigh, East Triangle, Garner, Wake Forest, Cary. So that kind of gets some level of fanning as you look at the number of members and see that happen there. But as we look at that, we've got 88%, almost 89% of North Carolina's population in a county that is covered by a local chamber. So they would have access through a membership with their local chamber to get access to Carolina Health Works. And then, excuse me, the Federation of Local Chambers are very, very excited about this because they hear every day from their small businesses, from all different corners of small business, how difficult it is to attract and retain headcount without being able to offer affordable health care. And this gives them the opportunity to be able to do that with a really reputable provider, but then also having something that looks and feels a lot like a large company plan that you would see in any .com style of business. But then, you know, this is something that's going to be differentiated for them because they have not had those options before. I've kind of just already covered this, but just to talk about it again, the local chambers are really sort of our eyes and ears on the street as it relates to what's happening with small business. They're getting a lot of push from their businesses and their members to make sure that, you know, this is available to them. It's been a great win to finally get that approval and be able to move forward. So here's the map that I referenced. The green represents sort of a marketing arrangement that we have with some of the local chambers. They're actively marketing to their members, versus the blue. Their members have access, but they may not be actively marketing to their members just because of availability of funds. You know, many of the small counties have very small chambers. They're under-resourced, underfunded, and they just can't take on, excuse me, the additional responsibility of pushing out a marketing program for this. But as you see, 61 counties represents almost 89% of the population covered. The ones that are not covered can join the North Carolina Chamber and get access to healthcare directly through the membership from us. All of that, again, being delivered by Blue Cross or agents of Blue Cross to meet those needs and sort of discuss and help them find what the right plans and the right needs are based on the challenges and sort of the unique situations that each small business faces. So that's all I had from a slide perspective. It's kind of a real high overview. I want to be mindful of the time and give you all a chance to ask questions, but then also to discuss how this may fit back into the recommendations that you all might have.
Awesome. Thank you so much, Steve. Madhu's had to step away for a moment, but would welcome any questions from the work group for Steve, particularly thinking about how this could apply and make a difference for our childcare providers in the state.
Looks like we have a couple of hands up. Samantha, do you want to go first?
Sure. One real quick one from me. So I realized that so basically what I'm hearing from you all about the plan, which is amazing, by the way. Thank you all so much for the yeoman's work you've done to make this resource possible for people. Could not come at a better time. Like, we realized that purchasing a plan through the exchange is going to be exorbitantly expensive in just a couple of months' time, and being able to access something like this is hugely beneficial to so many organizations. And I'm just very grateful for your willingness to talk with us about how we might best share this opportunity with small businesses in the early care and education industry, especially. Something that I'm curious about is, because I realize there are sort of multiple pathways to satisfying that third very simple requirement for eligibility, which is either being a North Carolina Chamber member or a Federation Chamber member. I realize every chamber might have different rates for membership, right? For small business owners, some of them have special programs to do special dedicated outreach to organizations that deliver a public good. Some of them have special rates for small businesses in particular. I know the NC Chamber has its own established rate. And the way that I heard you talking about it, is it your sense through the program administration that the preference would be that folks prioritize joining their nearest chamber first? The benefits administration simpler on you all, because I can only imagine you've got a lot of people coming on board trying to figure out how to access this. And then as a secondary option, consider becoming eligible through NC Chamber membership, or what, is there a recommendation on that we can be mindful of?
Yeah, absolutely. And I think you hit it perfectly. The local chambers know their community. They're also set up to support their local chamber or their local businesses in a different way than we can as a statewide chamber. There's a lot of small business opportunities that they have at the local level that we just can't, and I quite honestly don't have the resources to replicate at this point in time. So yeah, I think that the preference would be, local chamber first, just because the overall excuse me, the overall experience will be better for them as a member of a local chamber. But certainly we are offering that opportunity where a local chamber is not available, so that we're not excluding anyone in the state from having access to Carolina HealthWorks.
It looks like we have a question in the chat from Susan asking about how it is beneficial to participate if each employer is selecting their own health plan, which is individually risk adjusted based on its employee pool. And then also wanting to understand, are people able to select plans that actually have low deductibles and copays and good coverage? She noted that their insurance for 200 plus employees went up over 30% this year.
Yeah, so there's several questions here. Essentially, the risk adjustment is beneficial. So there's a couple of things. So selecting your own plan allows you to sort of tailor the plan and select a plan that's right for your business. Some businesses may want to have, a very low deductible and be willing to pay a higher upfront fee. Others may want a lower upfront fee and just basically pay a higher deductible because they have a healthier, younger workforce. So that just gives them the flexibility to not be sort of forced into a single health plan that's sort of one size fits all. It gives them the flexibility to sort of have a conversation with their broker and find what is the right structure for their business. The risk adjustment component of it, there's a shared risk component, and then there's a risk adjusted component. The shared risk is through the collection of all of the employers coming together. You have the opportunity to sort of smooth out some of the overall risk of high payments. So if one individual organization has unexpected payments that are not covered by their premiums, it is able to be absorbed by the larger organization, the larger group, without that single individual provider or individual employer having to make up for that entire difference, which is sort of what the traditional self-employed plan would require. But because you sort of collect all of those employers together, you're able to mitigate some of that risk. But when you sign up for your plan, because each plan is individual to the organization and to the employer, they're able to look at the risk characteristics of that organization. I've used the example before of if you have a group of new college graduates that are starting a health food store and need health insurance, their rating is going to be much lower than an industry like a mining industry, which has got common occupational hazards and air hazards and other things. And I'm not picking on either one. I'm just trying to differentiate and that through an analogy, sort of how risk may be viewed from an insurance perspective, and the benefit of that lower risk gets passed to the employer as they are purchasing that insurance. So on the point of increases, you're absolutely correct. So we're seeing 30% is probably kind of a on the middle to lower end of what we're seeing from increases this year. If you look at sort of the rates increases and the requests that were made at the state this year, the average increase is anywhere from 18 to 38%. That is before subsidies go away. So once you take subsidies away on some of our most needy populations within the state, their health insurance is going to double or even greater after subsidies are taken away and not available. So yeah, so this 2026 is going to be, and it's just definitely seen it in the news. It's going to be the year of sort of significant, massive increases in healthcare costs, insurance costs, which is, it's nice that the timing worked out that we have an alternative now for this segment of the business. But we still need to be mindful of all of the contributing factors that go into that. So, and I think, Rhonda, at one point you had your hand up as well. Do you have a question?
I just wanted to ask a quick question. This is wonderful news. Where do we access this information to share? Either to like send this to my HR company to review as a comparison, and other small businesses. I'd like to be able to share this with other preschools. Where can we access this information?
There's two great sites. There's one on Blue Cross Blue Shield site under Carolina Health Works. There's one under the NC Chamber site. If you all will give me a minute while you are discussing, I'll try to drop both of those links into the chat. The other area is just any insurance broker that covers the Blue Cross portfolio will be able to give you perspective on these plans as well. So they've all been trained. So.
Yeah, so I should just reference, like if our HR company, they're comparing now. I should just reference Carolina Health Works.
Yes.
Okay, got it. Thank you.
Great.
And Steve, if you send us a blurb of information afterwards, we can send it out to not only this work group, but the larger task force as well.
Okay.
So I know we are getting short on time. Really appreciate your presentation. Sorry that I had to step away for a couple minutes. But I do think this is going to be an exciting option for a lot of folks. And so just to go back to our slides, if you don't mind sharing, and I think we probably will only have time to just round out the discussion on this health insurance part, and then we can use the rest of our time at at the December task force meeting to talk about childcare for early educators. So with this particular recommendation around really trying to make it more accessible to provide non-salary benefits like health insurance, would love to hear any reactions from the working group members about any concrete next steps that you want to make sure to lift up and that we can do to keep advancing this work, particularly around health insurance. We know it's not the only one. There's interest around retirement benefits and other things like that, paid leave, et cetera. But that's one question. Also, back to the points Elizabeth made earlier, there are a couple of different ways we could be talking about health insurance. One is more of like trying to maximize the number of early childhood education professionals who have health insurance, period. And that might take us down more of a route of exploring how do we make it easier for people to access Medicaid or Marketplace or even things like Carolina Health Works, versus thinking about it as a recruitment and retention tool might take us down more of the path of looking into the state health plan, which I will apologize that we have not been able to get some of that background from the treasurer's office, but we're still working on it and hope I can lean on some of our legislators to get some help with that. But we'll open it up for reactions and feedback from our work group members.
I'll just say briefly that these are all steps in the right direction. As far as additional areas that we can consider, I think that don't include direct compensation. I think we're already working on those things. The healthcare is a big one, additional benefits, and also just, of course, childcare subsidy. I think those are the big ones, and those are things we're working on that could have others are able to do, and the funds that they have available to be able to look at creative ways have the capacity to increase teacher compensation directly themselves.
Thanks, Rhonda. Representative Crawford or Susan or any of our staff from the task force, any other thoughts?
All this information has been very helpful. I don't have anything right now.
I don't want to talk over anybody, but
No,
I have
go ahead.
one low hanging. Oh, never mind. I see.
Susan had a comment.
Susan's comment. Yes.
I think the state health plan is not a viable option in the present environment all around, unfortunately. I do think if there's a way to do what Ms. Rhonda said, which is do outreach and navigation for childcare business owners who are trying to get health insurance for their employees, that would be a tremendous help. Or to childcare teachers themselves who need health insurance. Thanks, Susan. That's helpful. That would probably kind of put us more along the framing that Elizabeth had said around like what are the supports we could provide to maximize health insurance through whatever the mechanism might be, whether it's Medicaid, Marketplace, or private insurance, as opposed to specifically recommending state health plan membership, I guess. But go ahead, Samantha.
Yeah, the only other thing I realized whenever we were talking about the associated health plan, which could be hugely beneficial, I realized we're talking about small businesses that are operating on very, very, very thin margins, and it might be difficult to demonstrate to them the benefit of being able to deliver this health insurance if we're not sure right up front what it will cost them per worker. So helping them access that information, and then also helping make sure they can access information about what it will cost them to satisfy that third requirement, which is they have to be a member of an affiliate chamber. And I think that there are definitely ways that staff and work group members and task force folks can help facilitate that, like pull all of that information together, because it is highly variable. Like different chambers and other business services organizations that are affiliated with the state chamber have different member rates. Some of them have special deals and like short-term pathways to stuff like this. Some of them would probably be willing to consider a discounted member rate to support small businesses that deliver a public good like childcare. So I feel like that might be a way that we could play in this a little bit and help, first of all, make the pricing a little bit more transparent, like to satisfy the chamber membership requirement. And then just get them the information they need about how to find a broker who can help them get a quote to determine if that's going to be financially viable for them to provide the benefit to their workers.
Really good point, Samantha. All right, any final comments? And then we are getting to time, so I will close us out. But any final thoughts? And if not, I want to just say thank you to Steve, Anna, and Brian for being on today.
Yeah, thank you for having us. And just Samantha, to one of your comments about cost, I just randomly picked a chamber in the western part of the state. I had just gotten an email from them about a meeting they're having. And their membership is $425 for the year. So just kind of just anchor on a kind of a price point that you could expect. And that one's fairly common, that's a fairly common sort of price point.
That's great. Thank you for that context.
Yep.
All right. Well, I know it is 3:30 on Friday, and it's been a very, very busy week with a lot going on. So thank you to our work group members for joining us and to staff for being here and our speakers. Stay tuned for more information from me on our work group recommendations. In particular, we will be doing some work to pull all of this together for our December report, and we'll likely be reaching out to you over email to get your feedback if there are some areas where we have open questions, or using our some time at the December 1st meeting to kind of hash out any final questions we might have about how we want to actually talk about some of the recommendations in the December report. But really appreciate your time and thoughtful engagement and being here as we continue to try to keep the ball moving forward on these really meaty and important issues. So thank you, everybody, and have a great weekend, and we'll be in touch soon with next steps.
Awesome. Thank
Bye,
you all
everybody.
so much. Bye-bye.
Thanks, everyone.
Bye.